Hello everyone, my name is Dr. Kiki Chang and I'm a child psychiatrist and a member of the Scientific Advisory Board for the International Bipolar Foundation. Today I'll be answering questions from the perspective of someone who researches pediatric bipolar disorder as well as treats children with early onset mood disorders. The question today is, why is it important to have the correct diagnosis for children with bipolar disorder? Well, there are many reasons why it's crucial to have the right diagnosis. First, you want to make sure that this is not something that like uncomplicated ADHD or attention deficit hyperactivity disorder, or it's not something like depression or anxiety or just some sort of mood dysregulation. The reason is that these are very different disorders that require different treatments. And so ADHD, for example, might require a different medication treatment than someone who has bipolar disorder. Depression is a very important one to distinguish from bipolar disorder because children with depression are often treated with antidepressants such as SSRIs. And it's becoming more and more understood that children who actually have bipolar disorder, when they take SSRIs by themselves without other mood stabilizers, they might be at high risk for having a poor reaction such as mania due to the SSRI. So it's very important to gauge which treatment based on the correct diagnosis. Finally, the other reason is prognosis and care. It's very important to be able to share with the family what this means long term and, again, how to care for the child, whether it's through a specific therapy or through other kinds of interventions such as working with the school or working with the family. So again, it's very important based on treatment and prognosis to have the correct diagnosis as much as possible, although we realize that sometimes it's better to say I don't know than to make the definitive diagnosis if you're not sure as a clinician.